everyone, and welcome to CCA's Medical Minute, sponsored by Kroger Health. I'm Sherry Hughes. Today is our 40th episode, and we're talking about ocular cancer today, aka eye cancer. And joining me is CCA's Medical Director, Dr. Phil Leming. Hello, Doc.
Hey there.
And we have a real special treat for all of you today. We have an ocular expert in the house, I will call him. He's an expert in ocular and vitreoretinal diseases, Dr. Basil Williams from Cincinnati Cancer Center and the Cincinnati Eye Institute. Basil, Dr. Williams, nice to have you here with us.
Thanks so much for the invite. I greatly appreciate it.
Oh, you're so welcome. Chris, our producer, and I were just saying before the show that we believe this is the first time we've actually had two doctors, two specialists in oncology here on Medical Minute. And I know there's a lot of brain power going on right here, but we got to stay focused, okay? We're going to make sure we give it to the folks at home in a way that they can understand it. So Dr. Leming, why don't you go ahead and kick us off with a conversation with Dr. Williams?
Well, Basil, you're always humble, but you're one of the world experts in a rare group of cancers that involve the eye. Tell the audience exactly what that is and what you do and how you get patients. And
yeah, sure, absolutely. So eye cancer in general is very rare. For adults, the most common thing we see is melanoma. Melanoma inside the eye is different than melanoma of the skin, and it's only about 6 in a million, so it is pretty rare. We also do see children with retinoblastoma, and that's so rare that in the United States, there are only about 250 to 300 new cases for the whole country. So both of those conditions are rare, and we also see other things that are even more rare than that.
Now, we know there's a primary and secondary ocular cancers. Of course, the secondary is when it's coming, you're getting the eye cancer from another source in the body. Talk to us about symptoms. What can people expect if they think they may have, or do you even suspect, is there a way that you could have eye cancer? Any symptoms?
Yeah, so I'll say if you're looking at secondary cancer, fortunately, we have a lot of treatments that patients are surviving much longer and doing quite well. And sometimes if they get blurry vision, if they get flashes of light, or if they see floaters, little dark spots moving around, that can be an indication of something going on, definitely if they have a history of cancer already. If they have no history of cancer and they have a primary cancer in the eye, up to 50% of those cases don't have any symptoms, and that's why it's so important to come in for routine dilated examination.
so how do patients get to you, with their problems that they're noticing?
So there's a number of ways to get to me. Most of the time, people will have a change in their vision, or they will go in for a routine exam and they will see their general ophthalmologist or their optometrist for a prescription. And something will be seen during those examinations, and then they will get referred to me. Working in the UC Cancer Center, there are a number of patients who already have known cancer conditions, and if they have any sort of blurry vision, they will often get sent to me directly.
Like you said, this is such a rare cancer. Could it be attributed to being hereditary in any way? And if one does have eye cancer of any sort, does it lead to blindness? Is that a possibility, rather?
Those are both fantastic questions. I would say that for retinoblastoma in children, there is a large hereditary component. And so we have conversations with people who have this as they get older about the possibility in their children. And so we start screening very early. In adults, it's only about 5% of patients with melanoma that have a hereditary condition. And so that tends to be less common, but we still do look into it in certain situations.
Dr. Leming, one of your specialties is melanoma, and I've seen like a direct correlation with melanoma and some eye cancers.
Now, and we've worked back and forth over the years. I was going to ask Basil, how would you explain the difference between eye melanoma and the standard cutaneous melanomas?
Yeah, so that's another fantastic question. So everybody hears melanoma and they think about on their skin or face or et cetera, and that's usually caused by sun damage, and that's caused by a certain types of mutations. When you have melanoma inside the eye, though, it is a little bit of a different process. Not only is it more difficult to diagnose because you can't see it, but it does not have the same number of mutations. And we've interacted some because occasionally patients with cancer in their eyes, it can sometimes spread to other parts of the body as well. And we work with our medical oncologist colleagues to kind of manage those situations.
With retinal or with ocular cancer being so rare, do you think a lot of people just kind of put it out of their mind and it's not even something that they think about? And who's at the greater risk? Is it male, female, white, black, Hispanic, or different minority groups? Talk to us about that.
Yeah, so I would say that almost everybody that we see and diagnose with one of these cancers has never heard that you can have cancer in your eye. So I think it is something that is incredibly rare and people are not necessarily aware of. Again, I'll make a plug for going in for your regular dilated exams so that this can be identified. And when you're thinking about who might have this condition, it depends on the type of cancer. So there's an even distribution pretty much between males and females and across all races if they have cancer elsewhere in the body. The same for retinoblastoma in children. In adults, though, with melanoma, it tends to be people more from a white background or lighter pigmentation. So darker skinned patients with darker eyes and darker hair are less likely to get melanoma inside the eye, even though it doesn't seem to be related to sun damage.
Mm-hmm. Okay, so you have on glasses, I have on glasses. Does that put us at any kind of a risk if you already have some eye issues? And Dr. Leming, he's talking about melanoma, something you know a whole lot about, and how it ties in with the skin cancer and fair and dark.
Well, eye melanoma is a different biology, and it's all the normal things about skin melanoma don't really apply that much. One question I have, Basil, is you're a unique specialty, and it's almost like martial arts. There's kind of like a heritage, a lineage of how people learn this. And I know you have this extraordinary background at, I think, what is it, Philadelphia Eye Institute?
Mm-hmm. So I've been very fortunate. There are probably about 40 or so ocular oncologists in the country. And I did residency and retina training in Miami at the Bascom Palmer Eye Institute under the direction of Bill Harbour, who created one of the most common genetic molecular tests that we have for melanoma. And then I did my oncology training in Philadelphia at the Wills Eye Institute under Carol and Jerry Shields, who might be the most famous ophthalmologists around. And so I've been very fortunate to work with some fantastic people. Absolutely.
What are the latest developments in treatment, and how would eye cancer be treated?
Yeah, so again, it depends a little bit on the type of cancer. So for some of our young children, we often use chemotherapy. It can be throughout the body or directed to the eye. For melanomas, we predominantly use radiation. More recently, there are a couple of techniques that are under studies where you use nanoparticles and kind of activate that with lasers. And so there are some really interesting things moving forward to hopefully reduce the side effects that we have with radiation.
So what made you go into eye melanoma and eye ocular malignancies?
Yeah, it's actually, it was a turn of events for me. I was playing basketball after college in Europe, and I was planning on doing banking. And a friend of mine's dad was an ophthalmologist, and I just worked in the practice for a couple of weeks, but he did oncology. And I met a patient who was 18 years old at the time and had a melanoma, and it seemed like such a devastating situation. But the way her family rallied around the doctor was something that was so meaningful to me and gave me a little bit of insight about the impact that I could have in that scenario. And so it completely changed my career path.
And you certainly are having a tremendous impact. And we have maybe about a minute or so left. What would you tell the folks at home about the importance of getting their eyes checked yearly? And does that help to determine if they would have a cancer in the eye?
Absolutely. So I would say a couple of things. First, if you notice a change in your vision, don't just expect that it'll probably go away. Come in and have it examined. And then in general, even if you hadn't had any problems in your vision before, especially once you get to about 40 or 50 years old, it becomes more important to get regular dilated exams. So that way, if something doesn't show by your own symptoms, the doctor will be able to identify it.
Dr. Williams, thank you so much for being here with us today and imparting some wisdom on ocular cancer. And thank you as well, Dr. Leming, for being a very gracious co-host with me today. Thanks to all of you for joining us for this episode of Medical Minute. Don't forget to share it with your friends and subscribe and hit that little bell there so we'll notify you each Wednesday with a new episode. Take care.